Welcome to the Rockford region and to Rockford Health System. Rockford Health System is a close-knit family of healthcare professionals guided by a very simple mission: superior care every day for all our patients. The Rockford region is located in northern Illinois, just 80 miles from downtown Chicago and about an hour from Madison and Milwaukee, Wisconsin. We're a tight-knit city of about 150,000 with a blend of small-town living and big city amenities. As you consider where to build or continue your career, we hope you'll spend the next few minutes with us and take a closer look at Rockford Health System and our community.
Hi, I'm Gary Kotz, President and CEO of Rockford Health System. Thanks for taking a few minutes to learn more about our organization and our community. I think you're going to be impressed with what you hear and see. As a physician considering a position in Rockford, you will want to know three things about us. First, Rockford Health System is invested in clinical excellence. Whether it is our outstanding patient outcomes, state-of-the-art technology, or the fact that we have received the Healthgrade's Patient Safety Excellence Award for several consecutive years, we are committed to being the premier provider of healthcare in our region. Second, the Rockford region is a great place to live. We understand the importance of work-life balance and what that means to our physicians. And thirdly, our physicians play a key role in leading this organization. There is one other intangible that is hard to portray in a video. It's something I feel here every day. It's the tremendous focus of our medical staff, compassion of our nurses, and dedication of our support staff. It is all about the patient at Rockford Health System. We call it respectful care, a promise we have branded in our community.
Rockford Health System is the most comprehensive health system in the Rock River Valley, with a storied history of serving the region since our founding in 1883. Here you'll find 450 physicians on the medical staff, nearly 3,000 employees, and more than 300 volunteers. Rockford Health System is known regionally as the leader when care is most critical. We have long been on the leading edge of medicine in our region, with a commitment to our medical staff to provide the latest technology, and one of the most comprehensive continuing medical education programs in Illinois. The organization includes Rockford Memorial Hospital, Rockford Health Physicians, Van Mater Health South Rehabilitation Hospital, Visiting Nurses Association, and the Rockford Memorial Development Foundation. As a physician at Rockford Health System, you'll be part of a group of professionals who care about their patients, who mentor and guide their colleagues, and who hold important leadership roles in setting the direction and development of the organization. Internist Dr. John Dorsey has been on the medical staff for 24 years and serves on the Rockford Health System Board of Directors.
I chose Rockford Memorial because I thought it was a good academic facility, that they really valued good quality physicians, they valued education. I thought it was a way of keeping my teaching skills going by interacting with the medical school. So I liked both the internal and the external environment.
Dr. Rich Hayes has been with Rockford Health System for more than 20 years and is chairman of the cardiology department in the Heart and Vascular Center. He enjoys working with a tight-knit team of colleagues who can really get to know one another.
The physician group is small enough that you really get to know the other physicians and their practice styles. You're not just a number, and it's a community where you do run into your patients on the street, fortunately not too often, but you do run into them on the street, and gives you the opportunity to develop very strong relationships, which I think actually have a valuable therapeutic effect on the care that you can provide for your patients.
Urological surgeon Mike Fumo wanted to practice at a health system that valued innovation and was willing to invest in the latest technology, like the Da Vinci robotic surgical system.
I thought coming here that I would be valued, and at the same time the health system was willing to take risks on technology that health systems that are bigger than this one might not have taken. And you know, it's been a success for me, for my patients. Hopefully it's been a success for the health systems too, and it's been a benefit to my career early on that I've been able to work with the health system hand in hand. And I'm an independent physician, so it's nice to be able to have that type of relationship.
Pediatric hospitalist Juliette Ugarte Hopkins enjoys the freedom to practice medicine in a supportive environment.
It makes a really big difference to work with people who you know and you like. This isn't a big conglomerate where docs are coming and going all the time. You have herds of residents and fellows running around that you barely get to know and then they're gone. The doctors who are here, we all know each other relatively well, if not very well, and that makes a huge difference.
Physicians are leaders, and leaders are physicians at Rockford Health System. Neurologist and Senior Vice President Kevin Ruggles illustrates why physician involvement is so critical to the success of our organization.
Working in a place like this where you have colleagues to help take care of patients makes you better than you would be if you weren't part of a team like that. And that really is what has continued on here, and we're continuing to develop as we build the health system and the physician group.
Newer physicians also play a key role in leadership at Rockford Health System. Internist Larry Verfurth joined our staff as a hospitalist only recently, and now serves as a vice president in a key role overseeing clinical integration and physician services.
As a new provider, I think we offer a lot. We have the ability to focus on your clinical life and your clinical aspects of your practice, but if you have a broader interest, whether it's quality medicine, working with our quality department, or working within administrative responsibilities, the opportunities are there. And I think Rockford offers a nice balance between being a clinician and as well as taking on administrative, non-traditional clinical roles. I think we have a structure that allows for that. In fact, it's encouraged.
We know that your lifestyle and the opportunities for your family are just as important as your career. You'll find that the living is easy in the Rockford region. Affordable housing found in historic neighborhoods and newly built developments. A variety of public and private school options for children. Plentiful recreational opportunities. Top-notch golf courses. Riverfront recreation paths. Nationally recognized museums. An award-winning park district. It's a lifestyle that blends small-town living with big city amenities. Don't take our word for it. Listen to what our physicians say about living in the Rockford region. Dr. Ronna Kalick chose Rockford for the combination of small-town atmosphere and urban lifestyle choices.
What really attracted us to Rockford is that everything is very close. You can drive anywhere and you'll be there within 15 minutes. The energy of the small town it's unbelievable. It's really nice. I mean, you just walk down the street and everybody says hello. Everybody says good morning, which you don't really see that in a large metropolitan city.
Dermatologist Melissa Stenstrom and her husband enjoy the activities that are available for their 2 young children.
I'm from generally a small town, and I felt that Rockford was a good medium-sized town that still affords a lot of the small town qualities that I look for. The people are really genuine. People are really thankful for the care that they receive, and it also gives us a lot of any of the shopping that you would request and a close proximity to the cities around it. So I think it offers a nice mix of a small town, but close enough to anything that you could ever want to do.
Pediatric hospitalist Dan Slansky and his wife, also a member of the Rockford Health System medical staff, enjoy the laid-back lifestyle that the region offers.
There's a lot of community activities, and you get all of that without any of the pretension of a large city. So you can go to shows, but be mixed in with people who are wearing jeans and a shirt with a collar and people who come in suits. And I just think there's no pretension here, so it's a very easy city to live in.
Internist Marisha Cook is a Rockford native who returned to the community to practice internal medicine and allergy. Her husband also works at Rockford Health System, and they were married at Anderson Japanese Gardens, voted the top Japanese garden in the United States.
It's a great place to live, a great place to raise a family. It's economical as well, and it's lots of great areas to go and have fun, and it's close to Chicago and Wisconsin.
Rockford Health System is a unique organization with a dedication to respectful care for all our patients, and we're proud of the physicians on our medical staff.
The most remarkable interactions don't have to end by saying, here's a prescription, here's a pill. Sometimes it's just a matter of saying, I hear you.
The most important thing for the patient is just to listen to them and really try to figure out what's going on instead of treating them like a case, treat them as a person, a patient.
If you listen to the patient will usually always tell you what's wrong with them.
Rockford Health System. Respectful care.
As you have seen from that TV commercial, we enjoy using our physicians in our marketing efforts. I know you have a difficult decision to make as you consider where to begin or continue your career, and I hope you liked what you saw about Rockford and Rockford Health System. I'd be happy to talk with you personally about how we can welcome you to our family.